been better, but now every time I scan, my hand hurts, my wrist hurts, my arm hurts, my shoulder hurts, my back hurts, my neck hurts, my eyes hurt. It's only been 3 years, but I think my career is coming to an end.
Gosh, I never have any of those problems when I'm scanning.
You're probably wondering, how did I end up in a situation like that? And the answer to that is not scanning ergonomically. Now I have all of these musculoskeletal injuries. To make sure you guys don't end up like me, I have a video I want to show y'all. Hi, my name is Michaela and I'm a sonography student here at Baptist Health Sciences University. Most people don't realize how physically damaging a career in sonography can be if you're not scanning correctly. In fact, 80 to 90% of sonographers report experiencing pain while scanning within the first 5 years of their career. And 20% of those people end up ending their career and retiring early due to the pain. Today, I'm going to show you guys how to not become a part of that 80 to 90% or the 20%. Let's get started. Everyone varies on whether they prefer to stand or sit during exams. Whichever you choose, you want the machine to be at a comfortable height. Starting with the screen, you want it to be at eye level to reduce strain on your eyes, neck, and back. You also want the keyboard to be at a comfortable level because you'll be using these buttons a lot and you don't want to put too much strain on your wrists, hands, or arms. Your patient setup is just as important as your equipment setup. You want to have your patient's bed at a comfortable level whether you're standing or sitting. If your patient's bed is too low or too high and they're too far away from you, you're going to have to lean over and overextend your shoulder while you're scanning them. This is going to cause pain on your shoulder, arms, and back. And doing this for every exam is going to lead to more serious injuries over time. Are you able to scoot over closer towards me? Yes. And then can I also get you to scoot down? Okay, perfect, thank you. While ergonomic positioning is important for our job as sonographers, patient care always comes first. Make sure your patient's comfortable as well. Are you comfortable lying flat or would you like your head elevated?
I'm fine like this, thank you.
No problem. Now that our bed, machine, and patient are all properly positioned, I'd like to show you some ways to scan that will prevent MSK injuries. Sonography is a very hands-on field. Therefore, the way we hold our probe and use our hands while scanning is very important. Ultrasound requires a lot of small hand movements. Oftentimes, the structures you're imaging are either really close together or maybe it's a vessel that you're trying to open up all the way. This calls for having to make small rotations and heel toeing to get the best image possible. When trying to accomplish those small movements, you want to hold your probe like this, with your fingertips at the footprint. This allows you to make tiny rotations that are needed. It gives you more control over the probe, as opposed to holding it like this, like this, like this. This is what you want. You want to make sure you're not gripping your probe too tightly, like this. This will tire out your hands and lead to injury over time. Instead, hold it lightly like this. When performing an ultrasound, it's important not to overextend your arm like this. You don't want to extend your arm more than a 30-degree angle. Holding your arm in the air while scanning for an extended period of time can get tiresome, can hurt, and can put strain on your muscles. Don't be afraid to ask your patient if you can rest your arm on them. When scanning, it's important to maintain a proper posture whether you're sitting or standing. This is what proper posture looks like. Both of my feet are flat on the ground, my back is straight, my arm is not extended more than a 30-degree angle, my neck is straight, and I'm comfortable scanning my patient. Scanning in an uncomfortable position or with improper posture, such as this or maybe this, is going to cause strain on your back and neck, and maybe even your shoulder. And this can lead to musculoskeletal injuries over time. As you probably noticed throughout this video, I emphasize incorrect scanning techniques that can place strain on your hands, shoulders, neck, and back. That's because there are several musculoskeletal disorders and injuries that can result from repetitive strain on these body parts. Carpal tunnel syndrome is a condition in which the nerves of the wrist get compressed or aggravated within the carpal tunnel. This can lead to pain, weakness, and numbness in the wrist and hand. Ganglion cysts are painful and palpable cysts within the tendons of the hands, wrists, ankles, and feet. A pinched nerve is a condition that results from the compression, abnormal stretching, or constriction of a nerve or group of nerves. Thoracic outlet syndrome is constriction of the nerves and blood vessels of the neck and shoulder due to repetitive strain. Not only do these injuries affect you while scanning, but they also affect your everyday life. The pain and complications don't stop when you clock out. Using ergonomic scanning techniques every day in your job as sonographers will allow you to reduce these injuries greatly and allow you to have a long, fulfilling career in sonography. Alright guys, thanks for watching. Remember these tips in these videos so you don't end up like me.